Hello and welcome to the Relax, It's Retirement podcast with your host, Josh Leonard, where we talk about transitioning into retirement with intent. I'm Wendy McConnell. Hey, Josh, how you doing?
Good. How are you today, Wendy?
I am just dandy, just dandy.
That I'm glad to hear. Glad to hear. I got the flannel on today, which, if you're just listening, it's great audio to talk about what we're wearing. But the leaves are starting to turn. It's fall, right?
It's fall. It has arrived.
Yeah, we
Yep.
have this real nice, like 50-degree night kind of thing going on now. I could take that for a while.
Windows open while you're
Windows
sleeping.
open. Yeah.
Yeah. Okay. It's also football. It's
Football.
baseball playoff season.
That's true.
I saw that you
Medicare
were
open enrollment.
All right, let's
Yeah.
let's move right along into that. Now, this is something that's only open at certain times of the year, Medicare?
Medicare open enrollment, yes, is once a year. So, Medicare open enrollment is the time that you can switch your plan. So, Medicare came 1965. The idea behind Medicare was, give elderly folks health care, right? Pretty good idea. Um,
Yeah, I like
Funny
it.
thing about healthcare is you tend to need it more as you get older. Go figure.
Absolutely.
Um, and it's super expensive. So Medicare helps control those costs by making it, a national system. There's pre-approved prices through Medicare, and we've talked in the past about Medicare. There's Part A and Part B. A generally covers you going in to the hospital, and B is for your doctor. Right? Those are the basics. Right? A was first, B was second. C is an advantage plan, which kind of wraps A and B together, and possibly Part D, maybe other things like vision and dental, because our healthcare system does not consider our eyes and teeth part of our normal body for some reason. Um,
Yeah, I don't know
never,
why.
never figured that one out, but those are separate.
Okay.
So Medicare is, what we transition to when we retire. When we think of retirement planning, for many folks, it has to be after age 65 because the cost of buying health insurance on a marketplace or, in the out in the wild, so to speak, is prohibitively expensive. I know when my mom first retired from her job at that point, our company did not have health benefits. So they were paying for their health benefits independently, and they were in their early 60s at the time. And it was like $2,000 a month, which, was a pain in the side until they could transition to Medicare. And
Wow. Yeah, that's a
that was a
lot.
big, it's a huge expense for most folks. It's unaffordable. Medicare kind of takes that burden off. Once we go through, so you're 65, you retire, you go into your initial enrollment period, which is up to 3 months before the month in which you turn 65 and 3 months after. So
Okay.
that's the time period you have to go on to Medicare initially. Well, the next year during open enrollment is when you can make changes. So if you kept with traditional Medicare, Part A and B, and maybe you bought a supplemental plan to help cover some of the gaps in there, to help cover some of the extra cost, and a drug plan, a Part D plan, this would be the time of the year that you want to go back and make sure that you have the best plan for you.
Okay. So, what are the actual dates?
Yep, October 15th through December 7th is when we have the opportunity to, change that plan. I think for our clients, the biggest one that we always want to make sure that we're checking on is the drug plan. So, Part D, checking on your drugs, right? Your drugs might have changed, the actual drug plan, the pricing of that plan might have changed, or the drugs they cover and the prices you're going to pay for those can change as well. Um, there is no penalty for switching plans or anything like that. So it tends to be kind of frictionless. That's something that we work with clients. We plug in any of the medications that have changed. We go back and forth with them and say, okay, this is the current plan that you're on. If we switch, maybe it saves you some money. I think using my parents as an example, last year we switched their drug plan again, and it went from a $10 a month plan to a $0 a month plan,
I
and the
like it.
cost of their drugs actually went down. Um, Now, this year, my mom has told me that the pharmacy that they're using as their primary through that plan, they don't really like. They've had problems with
Mhm.
them. They have to go back 3 times to get the drugs. So can we use a different pharmacy? Maybe we shop out using this other company pharmacy. Don't want to badmouth any big pharmaceuticals. That's a dangerous game, Wendy. Um,
I wouldn't dream of it. So you can't just change your pharmacy at any time? That's something that has to be
You
during
can, you
Oh,
can, but
okay,
certain plans, individual pharmacies have different, or chains of pharmacies have different pricings within that.
okay.
So if you really like, if you like going to the grocery store and picking up your prescriptions there, you can shop for a plan based on that. Now, if it's substantially cheaper for you to go down the street to the other pharmacy, maybe it makes sense, to save $100, you'll go to a new pharmacy. Those are things that you can shop when you're looking at that plan.
Okay. I like that.
You can also do things like mail order, where you can get them mailed to you as well, which is sometimes significantly cheaper too. Again, depending on the type of medications you take. But what we find in retirement is that the medication list changes over time, right? Maybe you started out in retirement where you're taking blood pressure medication or something like that. And then by the end, your list is like 20 different drugs. So,
Well, because at that point, your spouse is retired and you have to put up with him, and he's
oh, yeah,
drinking
yeah,
crazy, and so you need stuff to help you with that as well.
that's right. Yeah, yeah, yeah. You're right. Maybe I flipped that. It starts with cholesterol and then it's high blood pressure. Um,
Right. Exactly.
but those things evolve over time. Maybe a new medication comes out, and many times those new medications are extremely expensive the first few years. So we want to make sure that those higher priced drugs are more affordable, or the most affordable they can be, by shopping out that plan. Maybe you chose to go to a Medicare Advantage plan, so one that wraps everything together, but you're not really satisfied with that plan for whatever reason. You could look to switch to traditional and buy a supplement, during this period too. So it's a good time to reevaluate. This is sort of the big opening that you have the most flexibility in your Medicare plans. So I would say the first point of the 4 things that we need to know, Wendy, is know those dates, right? So October 15th through December 7th is your opportunity to shop those out. So if you've worked with a broker, an advisor in going through those plans, do it again. Medicare.gov, the Medicare website through the government, has phenomenal resources there. You can actually plug in your drugs and kind of shop through the plans there as well. So if you aren't working with an advisor on it, that's a good alternative as well. You can kind of self navigate through there to make sure you have the right plan for you. But don't do it on December 8th. You got to do it prior to. So,
Right.
like anything, don't wait till the last minute to.
And
I
this
always
is
mentally think it ends December 1st, right? We got to
that
take
way
care
you're
of it
covered.
sooner than later.
Yes, yes. But again, this is when you probably have already, applied for it. You have it because of that 6-month window of retirement. And this is basically for when you want to make changes.
That's correct. Yep. Changes if you're already enrolled. So this is the time of the year for that. Yeah, as we talked about, it's your initial enrollment period is a 7-month time period. So it's the month in which you turn plus 3 months on either side.
Okay.
Um, so yeah, this is the time to make those changes. I think the key point number 2 is to look at your current plan, see if there's any changes within that plan. As we talked about with the drug plan, if the cost is going up substantially of that plan on a monthly basis, well, let's make sure that your total cost, not just what you're paying for the drugs, maybe it makes sense to pay more on a monthly basis for a plan if all of your drug cost is substantially less, right? So we want to see what's the projected cost for the full 12-month time period, not just the monthly cost of the plan. There is a big caution there with Part D too. When you do that initial enrollment, you want some sort of drug plan if you're on Medicare. Otherwise, you're going to be assessed a penalty for not taking it. So if you're not really taking any drugs, then great. We filter for the cheapest plan in your area and we buy that plan, right? And as I mentioned, in a lot of areas now, there's like $0 plans or 50-cent plans a month. So certainly don't think that it's, a car payment or something like that. A lot of the plans are quite
$2,000 a month.
affordable. Um, you know, reviewing, sometimes we forget how much our health changes throughout the year, right? We think, oh no, we've been taking the same meds. Plug them back in, look at it again. It's a very helpful exercise to make sure. I mean, maybe you started taking a new drug in January and didn't even think about that. Oh, that was this year. Let's make sure that it's covered in your plan in the most robust way. So, second point there, make sure you dig into the details of your plan that you're currently on to make sure that it's still going to fit your needs for the next year coming.
Okay. Duly noted.
Yep. Third point, I'd say understand the differences between traditional Medicare and Medicare Advantage. We talked about that a little bit. The Medicare Advantage, think of it like a traditional plan that you had while you were working, right? Things are going to be covered up to certain limits. If they feed you Advil upside down in a hospital, it's a totally different cost than if you were right side up in the hospital. So there's all kinds of different billing structures there. So we want to be careful. Many times, those advantage plans are lower cost overall than a supplemental plan, but we have to make sure it's covering what we need. A supplemental plan, we're going to have a higher cost. Typically, this isn't in every scenario,
Of
on
the
a monthly
premium.
basis, but
Right.
it's going to cover a lot more, right?
Okay.
Just like any other insurance, right? If the cost is lower, it's typically covering less.
Yeah, so you just have to figure out what is best for your specific needs. Oftentimes, is this when people, kind of lean towards the advantage if they want to make sure to keep the doctors that they have and they might not be under the regular plan, like that kind of thing?
It could be. So in advantage plans, there can be in and out of network doctors. That's a big thing during Obamacare. You can keep your doctor, right? We all want, especially if you have a great relationship, you want to stay in that same network. In the Pittsburgh market, we have Highmark and UPMC, two sort of divided. So if you have a UPMC for life plan, which is a big advantage plan in Pittsburgh, many times you can't go see a lot of the high mark doctors. So if your doctor's in another network, that could be a problem. Traditional Medicare, it doesn't make a difference. You're not going to have in and out of network. It's only on those advantage plans. So if we're looking at a advantage plan that's super low cost, we do want to assess those doctors. Maybe you went on to an advantage plan not realizing that when you first turned 65. This might be a good time to reevaluate and change. Much like car insurance, we don't want to be switching to a better car insurance plan after we crash the car, right?
Yeah,
We want to have it prior to the car crash to make sure it covers the incident of the car crash.
exactly.
So a lot of times for clients, if it's affordable, we encourage them to have more robust coverage because later on in retirement, it's going to be harder to switch to a more robust plan because it will be medically underwritten. When you first go
Mhm.
on to Medicare, it's not medically underwritten. You sort of get a free pass. So if you have pre-existing conditions, um, that is not assessed in the cost of the plan. When you switch in the future, it will be. So we want to be careful there.
So your
Um,
best option is at the beginning.
Absolutely.
Okay.
But if you're 67, you've been on Medicare for 2 years now, and you're thinking, hey, I'm still healthy now, but maybe I want more robust coverage for the future, now would be a good time to switch. Again, just like the car insurance, we don't want to wait until after the car has crashed to make those changes.
All right.
Again, cost is going to be a big element, like it is for anything in life, Wendy. So we need to see what fits into your budget and covers you as much as you can. I think common enrollment mistakes we see that we want to avoid is setting it and forgetting it, right? I did this all last year. I don't want to do it again. I'm not going to do it. Well, it makes sense to reevaluate. I think even through your employers at the Leonard Advisory Group, we just had our benefits enrollment period, and makes sense to look at it again. I think reevaluating if it makes sense, looking at the different benefits offered, is something that's always good to refresh. We keep telling our team that repeatedly, like, guys, we pay a lot of money for these benefits. Please take advantage of them. It's the
Yes.
same thing. So
Yeah.
maybe if you're listening to this and you're younger, well, also look at your employee benefits as well. make sure you're evaluating those options.
There was a commercial a couple of years ago where, I think it was a woman saying to her husband, "Did you call and check the plan?" And he's like, "I called last year." And she's like, "I told you it's different this year. You have to call again."
Yeah,
So
I mean, those are probably the conversations at home. The good news is it's getting dark a little bit sooner in the evening, so maybe, sit down on one of those cool evenings and figure it out. Um, you don't want to forget about it. You want to make sure that you're assessing those regularly. Again, updating your drugs. Maybe your dosage has even changed on an individual drug, or you decided to switch doctors. Let's make sure that those are all covered underneath what you want. So don't set it and forget it. Medicare is a complex system, so there's a ton of resources out there. Don't quickly move into one thing or the other. Understand the pros and cons of each, right? So whether we're talking about advantage plans or a lower cost drug plan, see what you might actually need and what's most affordable to you.
okay,
It's pretty
sounds like
certain that we're all going to have more health expenses moving forward into retirement. So let's plan accordingly. Um,
yes, and
when you're
prices are not going
younger,
down,
what's that?
and prices are not going down.
No, they're not. They're not. Yeah, healthcare it can be a whole separate political conversation, but this is the system we have. Let's work within it. Um, your costs are not going to go down in retirement. We've cited before Fidelity's study where the average married couple is spending over $250,000 on medical expenses in total. So let's get good coverage to help reduce that out of pocket cost for you.
So,
Um,
where does long-term planning or long-term care or long-term care insurance fit in, Josh?
Yeah, so that is a whole separate piece. So, much like our eyes and teeth, that's not included. Long term care insurance is separate. That would be a totally separate plan. And I think in long term care planning, we want to think of that as an option that we either want to insure, set money aside, or try to get rid of money for. So you can certainly spend down and go on to Medicaid, which is what the average American does, right? The cost of long term care is extremely high. In many cases, if you're looking at a private room, it can be $10,000 a month. That is a lot of money to be spending on care, especially if you're confined to a facility for months. You can certainly insure on that. A lot of insurers have left the marketplace from traditional long term care. Some of the issues that we've seen with that is the cost goes up as your age group gets older. Um, when my dad first started in the business, he did a lot of long term care insurance, bought it for both my mother and or his mother-in-law and his mother, and he paid for those policies for years. And what happened is the premiums or that annual cost kept going up as my grandmas were getting older, and the probability of their care also got higher. So you didn't want to stop paying for that because now you're probably going to use it. But
Right.
as that age group gets older, there's a higher claim rate and the pool of money, so to speak. You need a little bit more to keep it going. Now, both of them have used benefits from those policies, but they became very expensive. So a lot of folks don't like that because it's an uncertain expense in retirement. If that cost doubles and becomes unaffordable in your 90s, well, that's not very helpful. So
No.
one of the alternatives is using like a life insurance policy where there's a defined benefit in it. It's only going to cover up to this much for a specific amount of time, but if you don't use it, it's still life insurance, so that death benefit would go to your beneficiaries. Another way that people use life insurance with long term care planning is hey, we're going to spend down these assets and then use life insurance to replenish assets to the estate. So if you wanted to make sure you left a specific amount to your kids, you can utilize life insurance as a tool to balance that there. It's not covered under Medicare, though. Medicare is not going to cover that long term stay, so we need to figure out how we're going to fill the gap otherwise.
Okay. Sounds like we need a plan.
We certainly need a plan. There is a lot of health planning in retirement too, whether it's Medicare, long term care planning. You know, You can also gift assets away to help protect from that Medicare spend down as well. Um, that has to be done ahead of time, though. There's a 5 year look back. So if grandma's going into the nursing home, she can't just write a check to her favorite grandchild and go into the nursing home. They are going to look back and say, hey, where did this money go?
Right, right,
Right?
right.
We,
Yeah.
we're going to claw that back before the government is paying the benefits, which is good for the rest of us as taxpayers, too. So
Mm.
it's a system. If you're going to gift away assets to family, you should start doing that ahead of time. So talking through that and developing a plan around that is certainly um, helpful ahead of time and not waiting till the last minute.
Yeah, well, I think that's what most everybody does. So let's try and get ahead of that. And what are the exact things we need to be doing, Josh?
Yeah. 4 key points. Know your dates, right? So we need to know October 15th through December 7th is our window to review our Medicare plans, make sure that they're still fitting our needs. Uh, we need to review those actual plans. So, not just checking the box. We need to review, make sure that those are fitting the needs. We need to understand the differences between the types of plans if we're moving from an Advantage plan to a supplemental plan. And also, don't just steamroll it, pass through. We need to make sure that we're aware of our plans and reviewing it annually, looking at our drug list, looking at our doctor list again. Um, you know, boring stuff, but very important if you're getting large medical bills. Let's try to keep those manageable as possible. It will help with all your other strategies. On our next show, Wendy, we're going to talk about ways to give away money. So, what's better? We're getting into that giving season. We're going to talk through 3 ways to gift money tax efficiently. No one ever goes broke giving money away, right?
No,
Giving
and
to charity is a good thing.
My Venmo number is
You have to be a qualified 501(c)(3) for many of these strategies, Wendy.
oh
Um, but we'll
shucks.
talk through 3 giving strategies. So if you're thinking of giving a little bit more around the holidays, or you had a bigger income year this year, we'll cover 3 strategies that can help you reduce and also give more uh, entering into the giving season. Thanks everyone for listening today. Be sure to like, subscribe, and share with your loved ones. Any comments or ratings help us reach more folks. If you have show ideas, feel free to reach out to us. We'd be happy to cover that in the future. Until next time, remember to retire with intent so you can make the most of your hard earned money.